if you have Dupuytren's disease and you feel the nodules inside your hand that feel really hard, I've had this question: can you massage Dupuytren's contractures or disease away? Well, I'm going to answer that for you today. My name is Huang. I'm an occupational therapist and a certified hand therapist. And in my over 20 years experience, I've seen many different types of Dupuytren's contractures in various stages and various forms. And I can tell you right now, you cannot massage away Dupuytren's disease. Dupuytren's disease is actually a disease of the fascial fibers inside your hand. And once they get hard, and once they're there, if you are the person who has it, like you have it, right? You can't massage it away. I will say though, what you can massage are the tissues around it, right? So in your hand, you have the bones that give you structure, and then your ligaments that hold your bone together so that you can safely and pain-free move your fingers. And the tendons and the muscles that are in your hand that help to move your joints, right? So when it comes to Dupuytren's contracture, what you can do is you can, the best results are stretching, and also if you have had the surgery to release the contracture, then massage is going to be that much more helpful and effective. So I'm going to just show you a couple ways in which you can massage if you have a contracture. So a contracture just means your joints got really stiff. So we have a big knuckle here, your MP, your PIP, and your DIP. Or as often as I like calling it, this is your big knuckle, your middle knuckle, and your little knuckle. So your big knuckle, your middle knuckle, and your little knuckle, right? And so what you can do in terms of massaging, you're not gonna massage to make it go away. You're not gonna massage to soften it. It is what it is, but what you can do is you can ensure that your joints are moving well, that your tendons are gliding, and that your muscles aren't so tight, right? So we can go joint by joint, right? So I'm going to show you on the ring finger, because the ring finger is where it most commonly occurs, that Dupuytren's cord starts to pull this big knuckle in, right? And then if it comes up, it's going to start to pull this middle knuckle down. And when this middle knuckle comes down, it also affects this little knuckle. So a great thing is you can make a fist, right? Dupuytren's does not usually cause any kind of pain, and what it does is it pulls it down, so you're able to make a full fist, not a problem. It's just that you cannot open it. So when it comes to massaging your hands because of a Dupuytren's contracture, the best thing that you can do is to massage to open. Right? So if you take a look, you can feel it. We have bones. If you turn the side of your finger, you can slide it down in between your bones, right? In between your bones here. Well, we have muscles in there. So if you see your hand, it's very thin, right? So you can find it on this side, but you can also find it on this side. So I like to use, if I'm doing it myself, I like to use the side of my thumb, and this is how I teach my own patients. Use the side of your thumb, and you can come and you go in between those knuckles. This is your big knuckle right here. When you bend, you see this crease right here. That's where your knuckle is. That allows you to bend. So you go right up in there in between, and you can massage those muscles. We have big sweeping ligaments that hold our bones together here as well. It's what allows us to cup our hands. So if you go and you massage in between it, you can help to loosen up the ligaments and the muscles so you don't feel so tight. But it's not melting away the Dupuytren's disease itself. It's not taken away. It's just helping you to be looser. But the disease will continue. And what happens is over time, it can pull and pull and pull. And at some point, you're going to want to go find a hand surgeon. But if you have a trusted occupational therapist or certified hand therapist, they can direct you to some of the best hand surgeons to work with, so that you can get a release of those fibrous tissues. But in the meantime, you can stretch, right? And you can massage so your hand doesn't feel so tight. So if you have this bone here and this bone here, so this is your fifth metacarpal, this is your fourth metacarpal, and this is your third. If this is your fourth, you want to go in between your third and your fifth, right? So you want to massage in between those, and that's just going to help to loosen up the muscles in your hand, right? So you're going to massage going upwards, right, to loosen it, but also when you massage going upward, you're stretching it open, right? We don't need to make a fist. You're already able to make a fist. It's opening your fingers that's a problem. So that's what I want you to focus on working on. So you go in between and you massage going upward, right? And then here to prevent, right, you always want to check your middle knuckle. So your middle knuckle should be able to straighten as much as any other knuckles. Like I have freakish knuckles, right? So I have what's called hypermobility. I have a lot of movement. So if I had that disease pulling me down, I would want that knuckle to go up as high as my other knuckles. See how freakish it goes beyond zero, right? So if you go beyond zero, you want to stretch it and massage it so it goes beyond zero. It's just wherever your knuckles are. Some people who have Dupuytren's actually, I call stiff as a board people. So there's loosey goosey people and there's stiff as a board people. Majority of the time, I've seen people who have Dupuytren's contractures. They tend to be stiff as a board people, so they don't have my problem, which is going into like way too much motion. So just go as much as you can. You can massage coming up on that tendon. And the key thing here is to massage in between your fingers because our muscles and our tendons kind of come up on the side as well. So you can make sure that you're massaging it. You can go across that, or you can just take your finger and you can just twist it a little bit. Twist it in one direction, twist it in the other direction, which direction feels the best for you, and you can go into that direction. And that's one way that you can just massage to make sure that your joints stay loose and limber, right? You want your joints to stay soft and supple is what I like to say. So you want to make sure that you're moving that joint, twist it to one side, twist it to the other side, which direction feels the best. You can do 10 reps into that direction. And then it's going to help loosen the other direction because, muscles only get long and only get short. So when you move it in one direction, it's got to give in the other direction, right? Makes sense? So you can do that here at the big knuckle. You can also do that here at, the big knuckle, and you can also do that here at the middle knuckle. Right? So you can see how I'm twisting. So that's a couple ways in which you can massage your fingers when you have a Dupuytren's contracture to just make sure that your joints stay soft and supple so you don't get a contracture. Right? But once those fibers start to pull, once you start seeing it pull your finger down a little bit too much, or once you start seeing that the fibers start pulling your middle knuckle down, I usually recommend going to see a hand surgeon, getting the release. I know it's surgery, and I talk often about not having surgery, but there are times when surgery is needed, and therapy can't fix it all. So that's a disease process of Dupuytren's, and once it starts to pull down, it starts to wrap around the tendon and pull down. And the longer you wait, the harder it is to keep your joints soft and supple. And talking to a trusted occupational therapist or certified hand therapist who can refer you to the best hand surgeon can really help you make those decisions. Because this is a non-emergency, it's best to do your research, get as much information as you can, and then make the best decision for you and your lifestyle. Right. So try those massaging techniques if you have a Dupuytren's contracture, and see how it can, kind of loosen up your joints and loosen up how your hands feel. But again, find someone in your local area that potentially can help you make the best decision if your contracture is getting worse. Right. Again, my name is Huang Tran. I'm an occupational therapist and certified hand therapist. If you like videos like this, do me a favor and hit the subscribe button. And if you have any questions or comments, definitely leave them below for me. I can't give personalized medical advice, but your questions really do help me to come up with more videos just like this to help you get rid of your hand problems. All right. Thanks again. Peace. Talk to you next time.